Now, this section I'm going to give you right now, I wasn't, I asked Chris over and over to make sure that you wanted to hear this part, because this actual program is called The Bulletproof Guide to Implant Success, and I'm looking at staff members all over. Here's what I'm going to do, because I definitely want your time to feel valued. I'm going to mix it up for you, because I could have gone, obviously, as he indicated, all day and given you all kinds of practice management stuff. And look, you're not going to learn implants in 50 minutes. But there is a reason why I'm talking about this that I didn't get a chance to get to, and I want to get to it. You're going to reap some very strong rewards, those of you in this room right now, if you listen to a little bit what I say, because it's not just that I'm going to talk about implants. I never got a chance to talk about what you could do to skyrocket your practice. So implants are just a branch off of what I'm about to say. So as I'm getting ready to talk to you, let me ask you some questions. Most of you all from down here in Tennessee, correct? That's in this audience? So I go all over the country, not full time, but I go all over the country. And the only place I've seen that has not sustained a serious dent in being successful is a lot of folks in Texas. And I think it's for a lot of reasons. But what is it like down here? Like, I'm going to tell you straight up, in the Northeast, everything was golden till about 7 years ago. And then, you notice that I said in my lecture, remember I said I've had 30 consecutive years of increased growth and profitability in the beginning. Remember me saying that? There was a little problem with that, because I've worked for 36 years. So I wasn't lying about the 30, but I didn't tell you the whole story. So the whole story is, in 2000, I guess 8 or 9, like some of my colleagues in this room, I had this amazing, that office that you saw was doing over $4 million. I had all my bills paid. Everything was cool. And I had the genius idea that I needed something more. I'm Steve Rasner. I'm a superstar dentist now. I can't work out of 30-year-old equipment. So I invested millions in a second office. That made it, but not right away, because that was 7 years ago. So I had nothing. I had no debt. It's interesting. I don't know if Chris is in the room, and all of a sudden I got all this debt. And then also on top of that, what happened is the economy plunged. So I had to reinvent myself and figure out, because, the recession of 7 years ago was not our first recession. I'm saying our, as those people in the room that are my age, 60 or older, that was our fourth recession. And I used to tell people that I am bulletproof to recessions, because I was. The first 4 didn't get me, but that one did. And we plummeted. So it's impossible for me to sit here and just lecture on implants. What I'm going to try to do is open your eyes to how impactful it could be to change your practice. There is nothing more. Well, there is something more. I'm going to get to it. So is it true that this part of the region of the country has also struggled in the last 7 years? Would that be accurate? Is it harder than it was 7 years ago down here? No? Not really? Go ahead, Doc.
Actually, last in a lot of other areas across the country having tough times. Not that we didn't feel it, but I didn't think we felt it nearly as much as some of the other areas.
Okay. Well, I'm not the kind of guy I'm pretty chill and laid back, but when I go to a town, but I could not help but notice an enormity of cranes from my trip from the airport to here. I mean, for me to notice that, you must have some shit going on. Because, I go to towns and I just say, what the hell? And then somebody told me out, I don't know if they were authentic or not, but they told me at the break just now that you have more cranes than anybody in the country. You have 16 hotels going up. If that's the case, then God bless you. And what I got to say to you is going to even help you more. Because that is not the case where I'm from. People are clearing out still where I'm from. And that is the case in a lot of places. I don't know if this is working for me, so give me a second. So I'm not going to bore you. I've reviewed these facts of what's going on, what's changed. I mean, this is a statistic from 2005, and I know for a fact, I mean, I've seen it with my own eyes. A lot of our colleagues retired. I got colleagues I know up in the Northeast that retired they got torn up on when the market went down, and they had to get back in as associates. It's pretty demoralizing. So here's where I want to begin with this part of the lecture, because this is where you need to start. So if you go back to this morning, there was a really quick slide I showed of Tom Lamoldi and Charles Blair. And as a speaker for 20-some years, I know other speakers. I'm not friends necessarily with a lot of them, but I have their phone numbers. So I picked up the phone about 5 years ago, and I called Blair, who I use, by the way, and I would recommend you use him. He's not my friend, I just know him. I said, Charles, what are you telling people? What are you telling my colleagues? Because I don't even know what to say. How are you telling them to deal with the insurance thing? And he said, well, they either got to produce 25% more, and I gave him my joke of how I felt about that with the Breaking Bad thing, or they got to become really good at something else that'll make people go out of network for them. That's what he told me. And I believe he's right. So what are your choices? Think right now in your community. What could you become? Like, you want to do better than you're doing right now, okay? Whatever that is, I don't know what you're doing. And what's your choices? So what if I say to you, okay, I need you to become really good at aesthetics. I want you to go out to the Arizona Institute with Frank Spear, and I want you to spend $20,000 and train, and that's going to be a game changer. And that would be a complete lie. It'd be a good thing for you to have, but it was not going to be a game changer. I mean, I did this case a couple years ago. I have a lot of, I've been out to Frank Spear's office 22 times. I flew from Philadelphia to Arizona. That was $5,000 a pop. You do the math. Plus the flight, plus the hotel. And, Frank, I have amazing respect for. So I can do cases like that. And if that color was right, you would like that case, trust me. It's gorgeous. Guess what? I don't care what aesthetic case I have. My phone doesn't bounce off the wall. You could be and there's no way to distinguish yourself in marketing as aesthetic dentist. How can you? Even if you have before and afters, yeah, you'll get some people that'll come to you. I'm not telling you, you got to stay with me here. I'm not telling you not to be good at aesthetics. You definitely need to be. I'm simply telling you that's not going to blow up your phone. So what else? What else can you be good at? What about this 6-month ortho? That's pretty exciting stuff we didn't have 10 years ago. I took the course. I don't do ortho at all. But I don't give a damn if you're the great. It's too boring. I mean, nobody cares that much to change. I'm talking about what can change your practice. This is a good thing for you to have, but it's not a game changer. If you think it's a game changer, then you don't know the impact about what I'm about to give you. I also said, or what about endo? I mean, today is so different than it's when I started. I mean, today, you got like 9 canals and a molar. That we didn't know all about that. We thought 3 or 4 was a big deal. And now you can do them in an hour. I think that's a good skill. If you were the best endodontist in Tennessee, you still can't market it. Hey, come to me. I'm great at root canal. That's not a turn on. That don't make your phone blow up. So you can't even use that. But this you can use. Oral sedation. And I don't know, I know the predominating organization out there is the DOCs. They call themselves docs. And they may be good, but I got something better than that. Because I've used it, and I'm positive. And I don't even have a brand name for you. You can call it Rasner if you want. But if you wanted the honest truth, an oral surgeon from Alabama is the one who gave it to me. It's the first thing you got to do as I'm talking about this. Now, this is going to lead to talking about atraumatic extractions, which is my afternoon course, and it's going to lead to implants. And it all makes sense. Just stay with me here. I don't give a damn if you're 60 in this room or if you're 30, what I'm about to tell you is your quickest ticket to enduring success. The first thing you got to do if you're, I see a lot of, God bless you, you're the staff or you're the doctors? You got to be the staff. Doctor in the middle? Yeah, I'm just getting old, man. I mean, everybody looks so young. I don't know. I'm sorry. Good for you. So you got to check your board of Tennessee because they're all different. I can tell you New Jersey is pretty much a role model. You got to take 60 hours. It's a pain in the ass of stuff that you probably know how to do, but they make you do stuff because you can't just start handing out pills in your office. So that's, and some states make you do an IV sedation protocol just to hand these pills out. But you just can't start handing them out. That being said, as I tell you all this, you really don't want to, you want to try it out. You don't really know if what I'm telling you is going to be as worthwhile as I'm telling you, then try it on a staff member. I don't know. Try it on your husband or your wife or your ex-husband, your ex-wife, I don't care. You ain't going to kill them, I'll tell you that right now. But I'm actually being serious. If I was me and I heard me speak and I was about to give you what I'm about to give you, and you got even a little bit of curiosity and want to know how it works, I'm not playing. Give it to somebody that needs work. You're not going to get arrested for one patient, and nothing's going to happen. I've never had one incident. One. I had to send patients before to 911 because I packed too much cord with epinephrine in it. Now, I didn't have to take a course on that, right, to pack cord, but I'm serious. I had to send a patient once 911 because they started having, all the cardiac activity. I don't know, I don't remember. It was like 25 years ago. But I have never, not one time, had an incident with the oral sedation I'm about to give you. Check your states. Next. The advantages are numerous. First of all, any schedulers in the room? Okay. Are we all docs? Okay. Well, whatever. It doesn't matter. Scheduling becomes beautiful because you're not going to schedule an hour for an oral sedation procedure. That's number one. So the doctor, I want you to remember everything I'm telling you because I know a lot of stuff about running a successful practice and I know a lot of stuff about clinical dentistry. But there is nothing I know better and more than oral sedation and how the impact is on your practice. And I'm going to tell you, you're okay that I'm not jumping in implants, right? Because you need, if I'm going to help you, me just telling you about implants for the next hour is not going to do it. You got to know why I'm going to talk about that. It all makes sense. The scheduling becomes beautiful because your days is going to be like this, doctor. You're going to see about, I'm not saying your whole day will be sedation, but you'll see about, I see about, after 20 years of this, 2 to 4 sedation patients a day, maybe 1 or 2 normal ones in between, right? And on the side, you can book on the side. Don't let anybody tell you different. There's a lot of people talking about sedation. There's a guy in Texas that says, people have different personalities. And there's a guy in Texas that says, you can never leave the room that they're in if you're sedated. It's complete shit. Sorry, that's how I talk. It's nonsense. You can. I'm going to explain to you why. If this was your office right now, and my operatories are from here to that guy over there, what could possibly happen in the 7 seconds it takes to get over here that I won't be able to save his life? First of all, the only thing that's going to happen is a laryngospasm, which means they choke. That's it. Nothing else can happen. I'm telling you straight up. So, and if that makes you uncomfortable, like that is my office. I have operatories lined up. So that is my office, and if you're scared, you can buy these things and you can put on the patient, and it's wireless, and you can hear them when they choke if you're in another room. My point is, you can leave the room. I wouldn't leave them in a locked-up room where you can't hear them at all. But if the doors are open and you have more than 1 or 2 staff members, and you have them monitored, which I'm going to show you need to do, of course you can. And that makes your whole life beautiful. Do you have any idea what it's like to work 2 to 4 hours or all day and not have to talk to patients if you don't feel like it? It's friggin' awesome, man. It is, and it's cool. Listen, you heard me for one day. You haven't heard my whole deal. And I don't pretend a little bit that what we do is easy. Because even if you have the best, and I have the best of the best, that's why my company's called Realizing the Dream. But it isn't easy. We didn't pick easy. You know, easy is maybe orthodontia, relatively, I guess. We don't have easy. It's hard what we do. So if I can make it easier and profitable for you at the same time, which is exactly what I have, then I'm doing something for you. So scheduling becomes beautiful because it's not as hard to schedule. You're going to be actually schedule less. You're going to be instantly booked out more. Cash flow is amazingly impacted, and let me explain to you why. You're okay with this explanation, the way I'm going with this, right? Because you signed up for an implant course, and I haven't even barely got to that. Are we cool or not? Okay. Somebody say no? We're good. Okay. The fearful patient is not that different than the infertility patient. And I picked that patient for a reason because my ex-wife had that problem, and I know firsthand when a woman is in her late mid-30s and hasn't conceived yet, what she will go through to get conception, what she will spend, because I lived it. So I know what it's like to have somebody say, hey, I heard you guys are struggling. There's this guy at the Mayo Clinic in Cleveland, because I did that crap. And you'll pay anything, because it's an emotional button. It's your life. It's your kids. And then after that one fails, you'll hear about somebody in Florida, and you'll fly down there, and then there's somebody up in Tufts in Boston, and you'll do that, and you will do it. If you can borrow the money, you'll do it. And I have the audacity here to stand in front of you today and tell you that it's not that different. You just don't know it yet for the fearful patient. They are crippled, and they're in all kinds of forms, and you just don't know it because you haven't marketed to them. And I never realized it would be so pervasive as it is. I didn't realize I'd have an endless market of scared people. And do you know why you have an endless market of scared people? Because most of your colleagues suck. I mean, they do. I mean, they're not at courses today, and they're burned out. I mean, because of what I said earlier, it's. You know, I'm never going to win the ADA president and be your ADA president because I say stuff like that. But I don't really care because I just tell the truth. You know, I'm out there more than any of you times 100 of meeting other dentists. And I wish it wasn't that way. I wish I could say, hey, everybody's progressive and go to courses all the time and they get it. Well, a lot of people just working 8 to 5 or whatever the hours are because they're burned out and they're not going to change their profession at 48 or 58 years old. And so while you're out here trying to learn techniques and think of different ways to be successful, they're thinking of other ways outside of dentistry to be successful. That's absolutely, and that doesn't make them bad people. It just makes it easier for you to be special. So they could give a crap about the stuff I'm talking about right now. That's the truth. So when these people come to you, because listen, 22% of all mandibular blocks are missed, even in today's statistics. So 1 out of 5 mandibular blocks, the hardest nerve block to give in medicine, not just dentistry, are missed. So here's what happens. What are you in the office? So here's what happens, and you know what I'm about to say is true. In a lot of offices, a doctor comes in, he gives a block, he walks out. He comes back in 10 minutes, he says, are you numb? And 99% of the patients say yes. Why? Because their tongue is numb, and they feel really numb because their tongue is numb. But you know and I know that doesn't mean you're numb. It just means your lingual nerve's numb. Okay, so unless you ask the proper question and care, and that question is, I did not do anything on your right side, so you know what this feels like. Does your left side feel different than your right side? Yes. Very different? Yes. Like rubber? Yes. No. Tingly. That means you missed. Tingly means you missed. And so not everybody cares about asking those questions, and I get it. But that's why a lot of people hurt. And then you got a doctor that's burned out that wants out anyway and would rather do anything than keep working on you, the patient, and then he convinces you that it's in your head. That's what the patient's saying to me. And then they get hurt. And maybe it's the middle of an extraction and the guy doesn't realize that he could stop, the guy being the doctor. So he creates this twilight zone forever effect in his patient. Trust me, they are out there in abundance. So when they come to you, and you know what the beauty is of the concoction I'm about to give you? If you and I train for ortho, a year out, you and I have different skill sets, or implants or endo. The very first time you give the oral sedation that I'm going to teach you today, you're as good as me the 1,000th time, because there's no skill set. What do you do that's skillful? You handed them 3 pills. There's no skill set. So what that means is the very first time you use it, you're going to be as successful as me after 20 years, and you're going to see what I'm telling you works. So the second time you do it, and the third and fourth and fifth, you know it works. So when that new patient walks in that day and says, I've been reading your ads, and I have fear, you're going to talk with amazing confidence of any other skill you have, because there is no skill in making them sleep. The pills do the work. All you got to do is do a couple things to keep them safe. You get me on this? You understand? Okay, so let's talk about what it is. It gives you, by the way, it gives you free time. You're going to actually, because they're sleeping, and they don't know whether you're in the room or not. I mean, 90% of them don't know. And 100% of them don't care if you're in the room or not. The room is dark, by the way. You turn the lights out, you put chill music on, or you put headphones on them. Okay, that's what this deal is. And you can go into hygiene for the first time in years and actually have interesting conversations. Hey, you can actually, when you don't have to just say how you doing, you can actually ask stuff that means stuff, and all of a sudden you're bonding with people, and you actually have time for pictures for Facebook. I didn't have that time when I didn't have a sedation practice. There it is. That's what I've been keeping from you. I'll send it to you. I'll tell you why it works. Benadryl has a sedative effect. In other words, it makes you sleepy. Atarax has an anti-anxiety effect. I don't know, I'm no pharmacist. I'm just telling you it does. Triazolam is a benzodiazepine, and if you mix the 3 together, it's a snore fest. As in they snore. As in 90 minutes. So take that down, try that out on your boyfriend or girlfriend, and see if I'm right. 90 minutes. Now, they're going to present to you in your office. I give this to them ahead of time. Chris, I know this is not exactly implants, but I am positive you're not going to get any complaints. Okay? I know this is what they need. We'll get to implants in this section. Okay, some of them are going to be wasted. Remember me saying this, and you're going to snicker and laugh when it happens, and you're going to think of me on this day, October the 28th. They're going to be horizontal in your waiting room when you walk in. I mean, they're going to be laying down. You need a wheelchair because of that. You're not going to have many like that. I'd say less than 10%. But you need a wheelchair in case that's the case, because you're not going to throw them over your shoulder. 2, and then you have to use nitrous. Now, don't let that turn you off, because you can get a nice portable system from, I can't think of the name of it starts with a P. Whatever, you have to Google it or write to me. And you put those people on 100%. You can get a portable system for $5,500, top of the line, nitrous oxide. That's the kind with the tanks right on it. So if you don't want to plumb your office and spend whatever it costs, just buy a portable, nitrous oxide, because you do need nitrous oxide. Number 2, you're going to have people moderately sedated. That's about 80%. They are perfect. I don't care if they're 80. I don't care if they're 20. They're giddy. They're laughing. They like the high they're on. Nobody's not going to like it. It's got an amnesic effect. They come back and you do the proverbial, you put them on 20% nitrous, and they're sleeping in 15 minutes. You understand what this looks like? In Tennessee, can a hygienist give injections? So you understand what my practice has become? It's become like I'm like an operating room doctor. I walk in, they're sleeping, lights are out, and they're numb. Hello? Am I liking this? By the way, you want to really get your hygienist up to snuff on anesthetics? Do what I did. I sent them over to my oral surgeons. Instead of saying my oral surgeon, hey, skip the cookie tray this year at Christmas. Show my hygienist every trick you know with giving mandibular blocks, because everybody can give an infiltration. Show them how to, and they did. And I swear to God, my hygienists are better than me. They're just awesome. Not all of them, but a couple of them are. So it's really an awesome thing. And so they're numb. Hello. And then there is a 10% category that will tick you off. And they'll say something to you like, hey, I thought I'd be sleeping. I mean, it's almost like they're happy it didn't work. Like, they want to, get in your face. So, what you say to them, and by the way, I can't solve all your problems. So, you have to have an extra room in your office to do this stuff because you can't always predict when they're ready. Okay? You can't say for sure that they're going to be exactly ready to start at 10 if it's 10. So I have no problem with the lady that says, I thought you said I'd be sleeping. By the way, they're usually chronic pain patients that have patches on them, or sometimes they're just people that partied real hard earlier in life. I'm serious. So, but you can't tell. I mean, I got an ex-Dallas Cowboy that I give him the straight up 3 pills I showed you. He's at least 300 pounds. It puts him out. And I got a little girl your size. I need to give more. But we'll talk about that. So I say, you're going to be sleeping. So I take them from 20% nitrous up to 50 or even 60% nitrous. Most of the time they tell you, I thought I'd be sleeping, they need more. So you take a second pill after 15 minutes. You crush it. Triazolam only, not all 3. The blue one only. You crush it, put it under their tongue so it bypasses the GI and goes right to their brain, and they will be wasted. Now, what else do I got to do? Get a pulse oximeter. The only thing that's going to happen that you care about is right there. Nothing's going to happen from their blood pressures and things like that, and I'll get to that in just a second. But the only possible thing that can happen is their pulse ox drops a little bit because maybe their throat will close a little because, they're sleeping. And so the bell's going to go off, and I could teach anybody in this room in seconds to pull a jaw forward. You don't need me to teach you that. Just pull their lower jaw forward and opens their airway. It doesn't take a minute. It's instantaneous. So if that bell's going off and you see, 90% instead of the proverbial 96 or 98, you pull their jaw, and it doesn't take, you're not going to have to go to the bathroom because you're scared. In seconds, as soon as you pull the jaw, it goes back up to 96 or 98, the bell goes off. Remember, 21 years, I've never had anything happen. Okay. But you do need this. You can get it from Salvin, you get it from whoever. This company, if you want to write it down, if you're going to really get into this, they've got everything. They got the wear on your ears, you can hear them breathing. I don't have any of that. It's called a sedation stethoscope. That's what it's called. You definitely need bite blocks. You probably have them anyway, but if you're going to do sedation, you got to get their jaws open. By the way, by the way, you need to know, I did 15 years of IV sedation, and I don't want to do it anymore because this is just too easy. And I had to charge for it, and nothing ever happened in 15 years, but I was always worried a little bit. You're never going to worry with this. Nothing is going to happen. You're not going to be able to find one piece of literature. I don't give a damn if you spend the next month and hire a detective that somebody's been permanently injured or in a hospital from the 3 pills I gave you. It's impossible. So, you get them open. Danger area. I told you that there's the guy that looks like he's got sleep apnea. And he's not even dangerous. You just got to know how to open an airway. Now, that being said, there's two things you got to do. You got to get, and you have to have, I live my life with protocols. I mean my practice, not my life. So that's why I have the protocol book out there. I'm not allowed to sell you in here. So, by the way, I have a little booth over there. Just time. Now, my protocol for this is whoever in my office who brings back a new patient could be a hygienist or an assistant. It could be either one. I don't know what it's like in your office. That person is responsible for getting their medical history, if it's a sedation patient, doing two things: getting a clearance from a doctor, which I've never not had clear, and more importantly, cross-referencing with a pharmacist whatever drugs they're on, because everybody's on a million drugs. I've never had anybody tell me anything except they're allergic to Benadryl. That is it. I've never had anybody tell me they're allergic to Trazolam. I've never had anybody tell me they're allergic to Atarax. In 21 years of doing this. I've never not. I mean, I want you to hear the words I'm saying, unless I'm just full of it, and why would I do that to you? I've never had a doctor say I can't do this, under any conditions. Never. So, what about kids? They're really tricky. So I've studied them for about 10 years, and I know exactly the formula for you to be successful with them. You want to know what it is right now? Don't work on them. That's it. Kids are out. What are kids? 12 and under, 13 and under. On your mind, if you're not sure, they're out. You don't work on them. That's simple. Now, that being said, that's my waiting room in my office. I told you it wasn't fancy, but I want you to really notice the pediatric portion of my waiting room right about there. There it is. That is the pediatric portion of my waiting room, conveniently located right next to the trash can, right there, because I have no pleasure in doing dentistry on children. So I actually don't want them to even come back. I'm kidding. I love kids, but I don't want to drill on them and stuff. God bless the pediatric dentist. So don't work on kids. Come on, Steve. Okay. I don't wear a watch, so I always do this. What time is it? It's 11:28. Okay, so I want you to ask me to send you this. There's not much, but I do want to point out, and what I'm talking right now about implants is going to totally extrapolate to taking teeth out. Because let me tell you why now I am teaching this course as well as atraumatic extractions this afternoon, which really should have been before this course. Here's why. You're going to get patients in your office from the fear thing. I'm going to tell you. I'm not going to tell you a lie. I'm not going to tell you your office is going to blow up in 1 month, but it is going to blow up in 6 months to a year if you stick to advertising to this. When you go out to that table, pick up the book that says Extraordinary Bulletproof Guide to Success. It's the last book I wrote, and look for the ads on fear, because I didn't get to do marketing with you this morning, which was a big section for me. But I do want to tell you that what can you market in today's world that makes you special? I already said you can't market that you're great at root canal. I mean, you're going to really do that and come to me? I'm a great root canal guy. I mean, nobody would do that. Or ortho, or even aesthetics. You can't even say that. Nobody cares if you're a member or you're an accredited member of the AACD. I just did the AACD from New York 2 weeks ago. You can't advertise that as if it's, a consumer doesn't know that. But every consumer in Tennessee and in Northeast United States knows how to say, you're the guy that works on scared patients. Everybody gets that. And you can market that really, really crafty and interesting. And that's what I do. So when these patients come in, you're going to get a lot of patients that have really big needs. You're going to get a lot of patients that really have not been to a dentist in 20 years. That's not my imagination. It's real. And so guess what they need? Extractions. So if you're going to do oral sedation, you have to commit to taking teeth out. Because it doesn't, what are you going to do? Put them in a cab and send them over to the oral surgeon? It doesn't even work. You have to do it. Now, I do not want you to do third molars. That's stupid. To me, third molars is like working on kids. Why? I mean, I don't know about you in this audience, and I'm a pretty tough guy, but I can never take psychologically the consequences of me hurting a kid in my office because I didn't know what I was doing. So I'm not doing that. If I kill somebody old, I'm okay with it. But I kidding, it's a joke. But I definitely couldn't sustain hurting a kid or anything close to it. And so, likewise, why would you go from 18 to 17 or 31 to 32? Don't you know on the most basic level of every dentist in this room, the least anatomy that you know, I don't care if you forgot everything we ever learned, there's bad stuff back, one tooth back. And the possibilities of running into severe bleeding and dangerous situations and paresthesias are way, way greater. Just one stinking tooth back. I guess I would feel different if we got paid $10,000 per tooth. Maybe it would be worthwhile cost benefit, but it's not. And so I'm not impressed when you take Carl Kerner's course on how to take wisdom teeth out. Don't do it. Don't do the wisdoms. You don't need to do the wisdoms. But you do need to do everything else. And I am going to promote and tell you, that look on my desk. I have a course that I teach on live patients for you to take teeth out. You have to come to New Jersey, but I will bump you. There's only a couple of them in the country, and I'm one of them. I've tried it for 5 years. I can't teach you on models. I can't teach you on pig jaws. I've tried it. It doesn't work. You have to do it on live people. And I have a license from the state of New Jersey to teach you from anywhere in the United States without having a license in New Jersey, and I'm going to throw you to the wolves. We are not going to pussyfoot around. I'm going to lecture to you for an hour in the morning on a Friday, an hour and a half, and I'm going to throw you out there, and I'm right next to you. And you're going to go patient after patient, and not wisdoms. You don't have to numb them even. I designed this course like I designed my practice. I don't even want you to worry about numbing. Learn that somewhere else. I mean, the only thing you got to really get down is a block. And everybody eventually gets the block. I mean, maybe you did it 20 times, but eventually we can get the block. But I don't even want you to waste time with that in my practice. So I'm going to have them numb for you. I'm not going to let you work on anything but ASA 1s or 2s because I'm not going to kill anybody on my clock. So they're going to be all safe. And you're going to go nail like 4 or 5 patients in a row, and then we're going to take a break. It's going to be like basketball training or football training. I'm going to make you do sprints by taking teeth out. And then we're going to talk about, like, what did you run into? What do you want to know? Then we're going to throw you back. That's the only way to learn it. But guess what? You can learn that in 2 days. It's like these courses they give in foreign countries where you do implants, except they're $13,000 and mine's under $3,000. So you don't have to go to a foreign country. So you want to know how to do this, as funny as I am about that I'm last in my class or almost last, I ain't no fool when it comes to taking teeth out. I'm a player. I know how to take teeth out. And I know how to make it real easy on you. The reason teeth scare you is because you can't see. You get scared because you don't know when to flap, and I'm going to tell you when not to flap and when to flap, and then you're going to do it right in front of me. Because I have that burden of responsibility because the state of New Jersey gave me authority to do it. So you want to know how to do it, I know how. But we're going to work on people like that. That's not a deal breaker. I just want you to know that from medicine. 160 over 105 is a common patient. Hell, it could be higher than that, to be honest. If you come in, and by the way, at the console, it's really easy to forget this. Take all their, you don't even have to do it. I'm all about delegation. Take all their pre-op vital signs. Have your hygienist do it. In a practice like mine where we're doing this kind of stuff, you don't, because maybe their natural oxygen concentration is 94, not 98. And you're going to be, freaking out because you think they're not getting enough oxygen, or they're naturally, like I have had patients 190. That's not an immediate deal breaker to me, to be honest with you. I will wait, sedate them. Sometimes I will even test numb them. And I can't explain why. Nobody's been able to explain it to me. But after I numb them, it comes down. Certain things you're definitely not going to do, and this is no different than what you learned in dental school. Diabetes is not a deal breaker, 50% of your population base. If their blood sugar is under 300, you can do successful implants on them. Obviously, you're not doing it on pregnant people. Osteoporosis, I wouldn't do it. I don't mean osteoporosis, I mean bisphosphonate therapy. I have done it. And I've had one patient have a problem. But, it's again, understand my teaching. I'm all about keeping you safe. There's plenty of patients that you don't have to sedate kids. There's plenty of teeth to take out that you don't have to do wisdoms. And there's plenty of patients to do implants on that you don't have to even consider doing a patient on bisphosphonate therapy. So don't do it. I want to send these all to you. Okay. I want to send that to you because time's a wasting. But if you're going to be the dentist in your community that doesn't hurt people, then you have to be the one that doesn't hurt with the injections on the people who are not sedated. And if you don't know this technique, ask me to send it to you. But basically, it's like this. Never mind. I didn't have it. Basically, I'll tell you what it is. Always have 2 needles out. The first needle has sit-to-nest, 4% sit-to-nest plain. Why? It doesn't have any acid in it, and it doesn't hurt. I'm not kidding. And use a blute. So before every shot, if I was going to numb any one of you, let's say it's the upper arch. First of all, you need a special, and you need to write me this because some things I've left out. There's a special topical that you can get down here somewhere in this part of the country. So ask me, because I won't remember. Don't ask me for stuff on this. Say, I need where you get your topical at, because it's different than anything you can get anywhere. It comes in a tube this big. You probably could have your pharmacy make it up, but I actually pay a guy. It might even be Tennessee. I can't remember. Indiana is where I get it. Yeah. Yes. Girl.
We use it. Yes. It's like 2 blocks from here.
Oh, duh. Okay. Well, there you go. What's it called?
Hollis Pharmacy.
Yeah, that is it. Hollis Farm. Wow. It's blue, right? Girl, that's good, man. That's right. So here's the deal. That stuff really is different than anything you can buy anywhere else. And again, you can have your pharmacy put it together probably for cheap. It's blue, as she said. It comes in a tube. You put it up there 2 minutes. You give a couple drops of sit-nest, and then whatever else you're using. That being said, if you don't know the magic of Septicaine, Zorocaine, Articaine, they're all the same thing. I have talked to Stanley Malamed. Nobody can explain to me exactly why, even him, but Zorocaine works better than any other anesthetic out there. And I use it on everything except mandibular blocks, because some people report paresthesia with mandibular blocks, and there's no science on it, 0 science that it causes paresthesia, but I don't use it just because I'm a human, and I've heard it causes paresthesia. But I will tell you this, from second premolar on the mandible to second premolar, I'm infiltrated. And in 40 seconds, they're numb. 100% of the time. If it's a molar, I'm blocking. Okay. But even on a mandibular block, I'm giving a sit-nest in a 30-gauge needle first before I go to the yellow with lidocaine. So I go in about 4 or 5 millimeters with a drop. Like listen, man, you got to care enough to do this, what I'm talking about. If that sounds like a pain in the butt to you, then don't do it. I'm giving you a viable formula. There's nothing even you got to buy. Think about what I'm saying. Somebody's going to come in, they're going to sell you a Cerac machine for $100,000. Like that. Look, my rep tried to sell me from And look, I'm not against Patterson. I love them. That's who I use. They're good people. But if your practice is struggling, don't go out and spend $140,000 right now on a scanner and that, and because somebody convinces you. I mean, I'm sorry, but I'm here for you, and I'm telling you the way it is. That ain't going to change anything on you. You have it right in front of you already. You just have to be patient. I mean, the road to success is right in front of you. Now, you got to be a fighter, and you got to care enough to get through some things. Like, right this second, you may not have to take teeth out. Learning the oral sedation is nothing. There's nothing to learn. All you got to do is start doing it, and it works. But, learning to take teeth out and some implants, sure, the implants take a while. Real quick management principle why we're having fun. A huge majority of offices lose patients weekly by not returning phone calls. Your staff is only going to know what's important to you if you tell them it's important to you. So this is how I tell them it's important to me. We have a return the call within an hour protocol. I literally have a board on a clipboard with a sheet of, it says return the call within an hour protocol. Now you may not solve the problem that they called within that hour, but you have made contact. So do you understand what I'm saying to you? That the number one way that you lose the patient is because nobody calls back? Now I know you drop the ball sometimes, and even I drop the ball sometimes. But a really bad situation is somebody telling you at 4 o'clock that nobody got back to Mrs. Smith that called you at 9. Because if I was Mrs. Smith, depending on what happened, I would have called somebody else. Okay? So, look, it's too hard in this environment to cultivate success. Once you have it, you got to keep them. And that's not a hard protocol. But your team, now, you might ask the next question, because I tried to stick to science in this one. But let me say this to you. So then ask me for the emergency sheet we use to send that to you. Ask me for the emergency sheet. Front desk people, this is what this is. So there's two things going on here. Are you okay for me diverting? I mean, I haven't said a damn word about implants yet, but I'm sorry. I mean, I'm trying to give it to you the way I see it relevant. So then I have an orange sheet like the color of your shirt that's like, bam, I can't miss it, okay? Because I don't want to miss it. It's for me. That sheet is for me. Front desk fills that out in detail. Example. Now, what I'm talking about right now is somebody that called your office next Monday or Tuesday that wasn't on the schedule, right? And we need to address it. That happens like 5 times a week, does it not? Maybe it's a lost temporary. Maybe they broke a tooth. Maybe a tooth came off of a denture. Your job as front desk is to get as much detail as you can. What if the call, what's your name? Kendra. What if the call was, the bridge you put in, my crown's loose? Do you get that call or not? I get that call. Okay? My crown's loose. So your job is you look up, you're going to say, you're not just going to go to the doctor and say, loose crown, Mrs. Smith. That means nothing to me. So what do I want to know first, you think? Is it my crown? Damn right I want to know. I hope it is not. Where is it? Has it had root canal? Because they almost always do. Has it had a history of post and core? Right? 8 out of 10 of them will. And is anything you want that in the middle of your day? Where's the doctor? Right? Yeah. You want that? I mean, don't you want to know? I mean, is there anything worse than a history of root canal, post and core, and it's not out, but it's a little loose? Yeah, there is something worse. When it's attached to something else that ain't loose. I don't want that at 10:30 and I got 15 minutes to fix you. Right? So that's why I need to know from you as much detail. Maybe it's a lower denture, which I hate. But you convinced me to make you one. Not you, somebody. And this is your 5th adjustment. All right? I don't want to hear loose denture from you. I want to hear 4 adjustments, inserted September 30th. I'm thinking, okay, maybe I'm going to have a consult with this woman. and tell her her options today. Because I know in my notes it's going to say I recommended implants. I actually have something like that going on right now, by the way. Understand? That is your job. That makes remember I said in the beginning of the lecture, I said, one of my jobs is to increase cash flow, increase case acceptance, and reduce the bumps in your day. This is reducing the bumps in your day. Another thing is people don't want to get your tape messages that say you're working on somebody else. They want, just no more than you want, that person with credit card information, and they transfer you 17 times. And, so this is how I feel about that.
You have reached the offices of Dr. Stephen L. Rasner. Please listen carefully to this message, as some of our options have changed. If this is an emergency, press 1. If you are a new patient, press 2. For normal office hours, press 3. If you would like directions to our office, press 4. If you have a question concerning a statement, press 5. If you would like to not talk to an automated voice and get a real person, we're sorry, but we are too busy, successful, and full of ourselves for that to be an option. If you would like to leave a disgruntled message, press 6. If you would like to hang up and come over here to kick my ass personally, please be advised that there is presently a 2-month waiting list.
So that's how I feel. Oh, there it is. You're right. I did have it. Okay. So, good. I did all this. We can skip this. Okay. So check this out. This is what an implant oral surgical sedation practice feels like. Monday, January the 12th, 10:30 a.m. That's my patient. This is what you could have a year from now. That's your patient, 10:30. They come in, they're sedated. That's your patient. Can't see from here. That's afterwards. 11:18. Now, I'm not in a hurry. In fact, remember, think about this. I'm taking photographs. I'm stopping that I don't always take to make a point with you. But even when I'm not trying to go fast, that took me 11:18, 48 minutes. That's my pay. You want to know how I do the numbers? Monday, 1 o'clock p.m. Those 4 teeth coming out. Implant on 23 and 26. There's a bridge 4 months later. 11,209. There are clearly cases of implants that are so easy. That's one of them. Taking a tooth out and leaving a 5-wall socket. 5-wall socket means if you stood inside the socket and looked around, you saw 5 walls. It means the buccal wall's not blown out because you broke it off or from an abscess. You follow me? I never knew what a 5-wall socket was, so you hear periodontists talk about this stuff. 3 walls, 4 walls. That's what that's what they mean. If it's a 3-wall socket, it means 2 walls are missing. What are the 5? Mesial, distal, lingual, palatal, and the floor. That's the 5. Okay? Even the guy 157 sounds smart on this. 157 in my class, remember? Okay. The second skill set that's a requisite is a traumatic extraction. It means leaving 5 walls. They're the 5. I don't want to do this. What'd I do?
This is how we do it.
Sorry. I'm going to skip all this. I want to get to implants because that's actually the name of this. We can cover some of this later. Okay. You're going to do I swear to God, you're going to do some cases that you're going to say, oh my God, do I really get paid for this? You can't see the printing because it stinks, but it says 18 minutes. Start time, 10:09. Finish, 10:15. That being said, any Italians in the room? Do you have any Italians in Tennessee? Well, do you like lasagna? How about that? Okay. Well, what would you pay for that? I'll tell you what I paid for it. I paid $27,000 for that plate of lasagna. So I'm trying to make another point. You know how I am. I make points. Why? I've been doing implants at that point 12, 14 years. On a Thursday afternoon, this beautiful 44-some-year-old woman came to me. It's been coming to me, by the way, for 25 years. Number 10 breaks off the gingival margin. That's usually what's going to happen. Doing implant dentistry is going to make you a better dentist in every facet. It's going to force you to learn things. And so you're going to learn that in 2016, extruding that tooth orthodontically like they used to teach you from Spiracois and recrowning it and doing a cast post and core just is not as good as pulling the tooth at this point. It's just the way it is. And so this is what happened. I placed the implant. I was so caught. I pulled the tooth. I had a 5-wall socket. That means I didn't break off any bone. It doesn't get any easier, except I didn't look at the angle of that root, which happened. You can see where the root was. That real root kissed the back of the other tooth. And I'm so important and big in life that I skipped even taking an x-ray, because that x-ray was taken on Monday when she came back and said, I'm sore. So I took it. I usually do take x-rays, but on that Thursday, it was such a slam dunk, I didn't even think about it. So I looked and I said, holy, rhymes with wit. So that's what I had now. Okay? I destroyed her smile. Now, I'm pretty good GP with periodontal skills. So I know how to graft, I know how to do connective tissue grafts, the whole thing. So I grafted her 3 times and got her to that, and got a nice ponic site. And I was going to make her regular crown and bridge. She didn't sue me at this point. She never did, by the way. But she didn't like this. And I felt totally responsible. I mean, I did do it. It's my fault. So I sent her to a world-class, and you might know the names, periodontist in Philadelphia. And the guy did a whole crown and bridge thing on her, all kinds of stuff on her. I sent her to 2 different people. It cost me $27,000. And she still wasn't happy. She wasn't happy. I would almost been better off had she sued me. So I'm not, y'all think about it. I've only been sued once. That was 35 years ago. I gave a guy a shot. And you know what malignant hypothermia is? Malignant hypothermia is you're born with it and you don't even know you got it. And your temperature spikes. And it can kill you. And a guy came in with an abscess, and he was almost crying in pain. I thought I was being a good guy, and I injected him and numbed him, and he starts violently shaking 5 minutes later. And I didn't know anything about malignant hypothermia, and I thought I had caused it, which I didn't. Trauma causes it. Incredible anxiety can cause it. You can sneak up on somebody, I didn't know this, with 2 cymbals and go like that and cause it, but I didn't know that. I injected him, and that's what happened, and he sued me, and he won $10,000. Because the jury, there was no jury, I settled it. I didn't know. Anyway, and then I swear, this is my life. The day I settled, not a week later, the day, on the cover of the ADA magazine that you and I get, there's never been a reported case of the malignant hypothermia from a local dental injection. So I didn't cause it, but I didn't know it, and I didn't know that article was coming out. It's real. I swear to God, it happened. But that's the only time I've been sued. But, 5 minutes, is that what you're showing me? I can't see that far. Yeah, that's easy this time. Okay. So she made me do it over. I paid a world-class prosthodontist $27,000, and she said, it's not as good as yours. I did it over. She was happy. So she's Italian, so she made me a plate of lasagna to thank me for being honorable. Hence, I paid $27,000. Okay. Implant training, listen to no one. There's no one person you should hitch your wagon to. You should listen to everyone and see what works in your hands. Do you listen to this guy? He's published. Well, what about this guy? Yeah, you got to be kidding. It's right. It's not a kidding. It's not a joke. Yeah, it's real x-ray. That guy? They're both published. That's the problem with implants. Him? That's an unusual situation. How would you like to restore that one? And why don't you just put it in the middle of the palate? That's a good case. Usually we try not to place in the sinus. So I'm telling you, don't be a cowboy. You're not going to learn this in days. There are absolutely certain implants you could do with 1 day's training. And that only applies, in my opinion, to taking teeth out that you took out atraumatically, and that's where you're going to put your implant. As soon as you have to flap, as soon as you have to start doing in areas that have already been edentulous, then you need more and more training. But I'm going to tell you something. You're going to get cases, I want to skip this. You're going to get cases, where is it? Where somebody comes in, and I mean you're going to get these all the time. That's it. I'm telling you, I get these, and I mean when I say monthly, it's probably more than monthly. You've had this case. Have you not had this case, doctor? It's not always number 8. Sometimes it's 7. Sometimes it's 10. Sometimes it's 5 or 12. All perfect areas to do, especially anyone but 8 or 9. 8 and 9 is tricky because of the gingival marginal levels, gingival marginal levels. But I will tell you that, like, hallelujah, when I see any other tooth break into gingival margin, because I know how to get teeth out, I know how to teach you to get teeth out, meaning a 5-wall socket's left, you could put an implant in that day. I could actually train you with 1 hour, and you would be fine with it. So, I mean, this happens. And now in my office, this is $5,200, everything. Extraction, bone graft, implant crown, and that's just a gift. I mean, there's nothing, it's just a gift. My heart doesn't go up, nothing happens. My heart rate, I mean. Let me see what I got here. And, you know, I put a temporary on the same day. I'm not going to kill you with this. This is the point this is the takeaway from here. If you're here in the afternoon, actually that course should have come first. Here's my point. You're going to orally sedate people under my protocols. It's going to be work for you. Those people are going to need you to take teeth out. Okay? So let's learn how to do that. If you're going to go to the problem of learning how to take teeth out, then you may as well take it the next step and learn how to put implants in, because there's not that many things to learn on the extraction. Implant goes right in. There is much more. Don't confuse me. With an edentulous area, a denture, patient wants to convert, that could take you a few years, but you're going to convert people. That's the second thing you'll learn. So the first thing you'll learn in implants is taking teeth out and putting them right in. And you can even do it in molars, but you wouldn't learn that in 1 day. But the second thing you're going to learn is giving people overdentures with implants in the mandibular symphysis. Symphysis is between the mental foramen. Okay, and you're going to learn to flap. There are no big structures there. Do you hear me? You're not going to flap and hit a facial artery between 22 and 27 because it's not there. Take a wisdom tooth out. There's a branch of the facial artery right back there. And there's a lingual artery branch. And you can, like, get yourself in a mess. By the way, you ever take a tooth out and you're with it for 20 minutes or more? Stop. Half an hour tops. You don't have to get the tooth out. You can send them home. They can bite on gauze. How do I know? I've done it both ways. They're not going to be in agony because you didn't get the tooth out. It doesn't work that way. So I want to save you the agita of what I went through, of missing a flight because I thought, I hope this was useful for you. Thank you very much. Have a great lunch. Thanks.